Hi, and welcome back. This is season 3. Very exciting. We've got 2 seasons in of the State of Healthcare podcast. This season, we're actually delving into what I consider the conditions nobody talks about. So if you haven't heard a lot of we never really researched or studied the female body, yes, we are definitely delving into that. That is a hot topic. Women's healthcare has been pushed aside for far, far too long. But we're not just going to touch on that. We haven't forgotten about the men in the world either. But we're going to be hitting topics that people like to steer away from. And I'm excited to hear that there's actually a lot more going on in these areas. But knowledge is power. So again, like in everything that we talk about, you need to fight for your healthcare. Knowledge is power. So you're going to hear about conditions and maybe things that you might have had symptoms on and you've been afraid to ask about. So that's what we're going to be exploring. So welcome to season 3. Yes, we have not really studied the female body, but we're going to be hearing about a bunch of things. So come along with us on this journey. Hi, and welcome back to another episode of the State of Healthcare podcast. And I am here today with Sam and Rebecca, and I'm going to let them open up and talk about kind of their roles and what they do. And obviously, I have a little bit of a prejudice towards physical therapy, so that's why there's a lot of therapy this season. But I feel like there's a lot of messages about conditions that we are out there that people don't realize can be worked with. So I'm going to kind of toss it over to you and have you kind of give me your background and what kind of patients you work with and things like that.
Okay. So hi, I'm Sam Arrow and I'm a physical therapist and I have my own practice called Arrow Physical Therapy and I prioritize queer people in my practice. I started my practice about 2 years ago now. I started out mobile and then almost a year ago, I opened my own office in Central Phoenix. So I see, I see a wide range of patients, but most of my patients are queer now because that's really the information that I put out there. Right. And so then that's who ends up finding me. Lots of people have pelvic pain disorders. And then of course, all of the usual things that we see for pelvic health, the urinary incontinence, fecal incontinence, organ prolapse. I do some pregnancy related things, but that's not the bulk of what I see. And then the biggest thing that I see is because queer people tend to have connective tissue disorders. I see a lot of people who have connective tissue disorders. I started out specializing in pelvic health, and now my specialty is taking a little detour, or right. I'm adding on treating connective tissue disorders and learning so much more about that as I see this, group of people who just tend to have them.
Okay. So cool. Okay. I'm Rebecca Patton. I own Patton Pelvic Health. It's in North Phoenix. And I'm a pelvic floor physical therapist. My main focus is chronic pelvic pain, probably just stress over sexual health concerns. I did an additional certification in sexuality counseling. So I really like to integrate sexuality counseling in with chronic pelvic pain people and how it distresses their personal lives or relationships, and really just trying to eliminate as much distress as possible as we're trying to go through this, not just doing the musculoskeletal side of things, but also how are they communicating? Where is their thought process at? How are they reconnecting with their body? And then of course, seeing lots of queer people. We both have a grant through Phoenix Trans Physical Therapy. So we offer discounted services for people who are gender diverse and trans non-binary. And so that's a really great outreach that we try to do to make sure people know that this exists for them and it's not just for cisgender patients to receive pelvic floor PT.
I have many questions for both of you, but first the grant. So what's involved in that? How does that help reach out or break that down a little?
Yeah, so we created this program that we named Phoenix Trans Physical Therapy because we saw this need, that there are lots of queer people out there who don't have access to care. And here we are, I don't know how many people would say that they specialize in gender affirming care for physical therapy and specifically for pelvic health in the state of Arizona, but I'm pretty sure that there's not many. We might actually be it. And we've been doing this for a long time now. So we want to make sure that people have access to us specifically, and we don't take health insurance.
Okay.
So like I said, we wanted to create this program to make sure that people could actually have access to us and get the care that they need. And it doesn't have to be just pelvic health. It could be for anything, preparing for top surgery, recovery from top surgeries, preparing for bottom surgeries. You're queer and you have a connective tissue disorder, you have pelvic pain, you have incontinence, you are pregnant. It doesn't really matter what it is. Come see us. And when I say we specialize in pelvic health, it doesn't mean that that's all we do. We'll see, because we're still physical therapists. We're trained to do everything. You're just lucky that we get to do extra stuff, right? Yeah. So
in an area that I think is actually growing, because I remember coming out of PT school and there was like a few people doing it, but like now I'm glad that it's growing, because I also feel like for so many years this has been an area that actually hasn't been addressed.
Absolutely.
So I assume that now you're probably, maybe not, I don't know, exploding, but like I'm assuming getting lots of people that are slowly coming out of the woodwork that have thought they had to just live like this.
Right. You know, when I first started as a physical therapist, that was 14 years ago now, and I started in pelvic health. And in Phoenix, there was like just a handful of pelvic PTs.
Right.
And now I don't know how many there are, like 30 plus something. They're all over the valley. So that's great. There's like more diversity in care. It's more accessible. It's still not enough. It's still like
for the need.
Right. The people who take insurance have 3-month wait lists.
Oh, wow.
So, but the great thing, like I was saying about the trans physical therapy, is that you can get visits for only $50 each.
Oh, nice.
And if people still have insurance, then we'll give them super bills so they can like put that towards their deductible or get reimbursed depending on what their benefits are. And they don't have to fill out any form or prove anything. All they do is message me or Rebecca and say, hey, I heard about this program. Can I be a part of it? And then we say, of course. So
and
that's it.
Can do that.
Yeah.
Okay.
And a lot of people reach out to us and fill out an intake form, and I'm like, oh, you're non-binary. Did you know we have a grant? So then I just tell them like, hey, by the way, you could have these sessions. Are you okay participating in like this grant? All we do is make sure we have people's demographics, and then in order to maybe reapply for the grant, we might ask for like some feedback on like, was this resource like beneficial to you?
So you guys have to kind of gather demographics and get feedback on like so that you think you fit.
We don't have to, but we'd like to validate like getting the grant again.
Right.
Yeah.
And then both of you are cash paid, right? Okay.
Yes.
Well, I'll start down there in order, but what made you decide to be cash paid and not deal with insurance?
Yeah, I worked in insurance space for a few years, specifically under pelvic health, and it was exhausting, right? I mean, it's like
you spend more time dealing getting
with
money
insurance,
than you actually get treating patients.
Honestly, it was like it was either I keep treating or I stop treating. But I mean, that's how tired of insurance I was. I was pretty burnt out. So it really wasn't a choice as much as like I have to save my energy, and my energy needed to go towards like treating people and like connecting with humans. And it can't be spent like behind the computer. Trying to fight like with insurance companies. And then just more and more I started getting into caring about specifically sexual health, sexual pleasure. And I think more and more it leans out of the scope of what an insurance company deems like something that is a reimbursable type of care.
Necessary.
Yeah.
And then for you, why was there like cash pay?
I mean, really, I had a very similar experience to Rebecca in that like I was burnt out. I also, because of like how my brain works, I really needed to have like the hour with patients. And the last place I worked, they were cutting down to 45 minutes with patients. I think I really needed my work environment to be calm and also very like gender affirming for myself.
Right.
And no corporate environment has done that for me. And I was in a similar situation where I felt like I gave my 2 weeks notice. The second that they told me you're going down to 45 minutes, I was like, I'm done. Like this was the push I needed to just like get out there and do my own thing. And I'm so glad I did, because now I get to the time that I would have spent, you know, like Rebecca saying, fighting with insurance and, you know, also trying to figure out how do I get patients the kind of care that they actually need versus the kind of care that's reimbursable. And like juggling that in your mind, I just was like, I just need to go and do my own thing. I either need to leave the profession or I need to do this.
Yeah.
So. Well, I have some questions on connective tissue in a second, but
Mhm.
because I see a lot of patients with that, but I was curious on what your certification that you went back for
Yeah.
with the sexual side of things.
So Pelvic Guru made a certification for sexuality counseling. I
Okay.
think they started it in 2022 or 2023. I'm not sure. It's pretty recent. It's
Uh-huh.
not a full, and then there are other certifications that you can go towards too. Mainly the main sexuality counseling certification is through ASECT, AASECT,
Okay.
American Association of Sex Educators, Counselors, and Therapists.
That's a
Yeah.
mouthful, but yeah,
Yeah.
I was like, dang, okay.
Yeah, so it's an extension essentially of your current degree.
Okay.
And then,
Uh-huh.
you have to have supervision hours.
Uh-huh.
You have to show like so much content that you've like covered and
Okay.
like been educated on. And then
Uh-huh.
it takes a long time. So I've done that certification and then I'm under supervision.
What does that allow you to do with your patients?
It allows me to go more into detail with strategies. And I really say like these are mostly like self-care strategies.
Okay.
So what the kind of language that you want to use with your partner, what are the things that how do you express your like needs? It could be like individual self-touch, it could be partnered touch.
Okay.
Mostly trying to address any distress that someone's experiencing in relation to like sexual health.
Okay.
And like so often I think sexual health is like for our patients, it's like icing on the cake. Like they need to be completely pain-free. They need to be exercising and doing everything else perfect for their health. And if they do all those things right, then they get to focus on sexual health.
Okay.
When we really want to like integrate sexual health as like foundational.
Right.
And it's not about quantity, right, of having sex. It's about anyone's level of distress. So you can still help somebody with like sexual health who falls like on the asexuality spectrum,
Okay.
right? To communicate with their partner and to like learn what is important for them. And, mostly there's such a wide range of like normal sexual function. So all we want to do is find out where someone's having distress and try to ease that distress. Like then it deserves treatment. It deserves attention.
This is probably a hot topic for both, but I've had patients that have talked about like, and again, just warnings and the things of sexual assaults or things like that, where unfortunately they have this history of trauma, which I'm sure that you guys uncover. And I've actually had patients that as they've worked with their pelvic floor therapists and been able to work through that trauma, a lot of their other pains that they're seeing other people for have started to disappear, and that kind of mind-body connection. And I just sexual traumas, I'm assuming that is something that you have to deal with a lot with the populations and things like that.
Yeah, I mean, absolutely. I would say that I can't give any percentages, but a large portion of the population that I see, and I'm sure Rebecca would agree that most people experience some sort of trauma, whether it's like from a partner or medical or, there's a lot of different ways that you can experience trauma, and they may or may not disclose those things.
Right.
I have something on my intake form that allows them to. And if I know about it, I might say, this is how if you're feeling uncomfortable in a moment because of something you've experienced in the past, this is how I would, handle it. And I basically do check-ins with people and say, hey, let's take a pause. Let's talk about like how you want to move forward. And so it's always very like patient driven.
Okay.
So that they can get the kind of care that they need and be as comfortable as they possibly can while they get that care. So yeah, we see a lot of it.
Right. Yeah. And I assume that's probably part of the stuff that you're addressing as well with that.
Yeah,
being
definitely.
Able to be comfortable.
It's like we integrate a baseline of trauma-informed care for everybody because so often people don't maybe connect ways that they've experienced trauma until they're here in the office, and then they start to put pieces together. Other times, I also think it's really important to say that I have patients with chronic pelvic pain. Right. And when I like tell them, hey, you have pelvic floor muscle tension, the muscle's like not moving really well. We call this dyspareunia, or we call this pelvic floor muscle spasms. Right. And they're like, well, nothing happened to me. I don't have any trauma. And I'll say that's not like a requirement to have this condition either. So I think it's really important that people know both sides of the coin, that yes, we see lots of trauma, from medical trauma, lots of various types of trauma, and people not feeling safe in their body. And it's not a prerequisite to having pelvic pain.
Right. So that you don't have, like, it's okay to seek care and be like, I'm just having this. I have the right to also have this addressed.
Absolutely.
It is interesting though, because even for me, like where I see primarily like orthopedic, like people from an injury or something that's bothered them for a while, there is a mental health component to it though, because this has now become part of their thing and it's changed the way they look at their lives. So I assume that also, whether there's trauma or not that led to it, this now has almost become its own trauma.
Yeah, absolutely. And I think so often, like, our foundation is connecting with mental health therapists. I think I connect more with actually mental health therapists than I do with even gynecologists at this point.
Interesting.
Because they're so integral to referrals for my patients, and like either coordinating care, or they see them first and get some things like baseline things so that they feel they can like find some regulation and strategies for in the clinic, or like something comes up along our treatment process and we refer out. So I think I have so many cards for mental health therapists on my table, and I'm always trying to match people with like, okay, I think this like would be a good fit for you. And then there are specific mental health therapists for sexual health. And that's through the ASECT website too.
Yeah. And I'll probably be bugging for resources that can connect all the things. So I want people to be able to feel like they can reach out, but kind of swinging it around. So connective tissue disorders, like, can you name, I mean, we've got like your Ehlers-Danlos and like your POTS and your things like that, but what are a lot of the common ones that you are working with?
Yeah, so I would say that actually a lot of the people come in to see me and they don't know that they have one, or maybe they suspect that they do. I very rarely have someone come in and say, I already have a diagnosis of this. But what I found in my practice, especially over the last like 4 years, as I really am like kind of becoming this like niche physical therapist, is that people will come in and they are queer, and then there's like this Venn diagram of different diagnoses that are overlapping. And so if you have one, you're more likely to have the other. And so that would be, so that broad like category of the connective tissue disorders. So that would be your Ehlers-Danlos, that would be a hypermobility syndrome. There may be others in there, but I don't actually, because I'm not an expert in it, I don't know that. But also going along with it, you mentioned POTS, so that postural orthostatic tachycardia syndrome, and then MCAS, which is mast cell activation syndrome, then just general like GI issues. Like they may have some diagnosis of like IBS, or I mean, there's a ton of GI diagnoses out there, but that's a general one that people get when things are just like not working right. And then another big component is neurodivergence. So there's a article out there called the connective theory, which I can send to you. And you could like link it to the podcast if you like. And it basically is, I mean, it is just a theory, but it's connecting connective tissue disorders to these different things. And it is theorizing that connective tissue disorders are actually the cause of neurodivergence, the gut issues, the POTS, the MCAS, all of that.
Interesting.
Yeah.
Because I've actually started, and again, it's always that thing, am I seeing more of this because it wasn't recognized, but now we're diagnosing it, or is it actually increasing? Because I started seeing someone more like mast cell. I've seen more people with POTS recently, and I'm like, what is going on? And in my head, I'm always like, I always want to try to find the root cause so we can assist in whatever way, but I would love to read the article. So yes, please fire over so we can link it over on that. Now with that, it's you said it's usually people coming in with something else and they don't even know. So sometimes I feel like sometimes niche practices, you start out and the niche practice picks you.
Yes, that's definitely what's happening.
You don't pick the practice. The practice is like, you know what? Here's these people, and you're like, okay, cool.
You pay more for this.
So I think that like, and then you get that, and you're like, well, I guess I will educate as much as I can. I was excited because you guys had like articles and things that you were researching. So start talking me through things that you have been investigating or you would like more research in.
Yeah. So Rebecca and I meet regularly to talk about pelvic health, and I think we complement each other really well because we have some like very similar interests, but then also some divergent interests. And I love it. We have talked about after gender affirming surgery, so specifically vaginoplasty, and trying to like actually create like a protocol for like how do you like if this is happening with your patient, like where do you go and like what are general recommendations? Because there are recommendations by surgeons, but there's not enough guidance and stuff inevitably goes wrong, right? And patients need additional care. And we are knowledgeable enough to like wade through the muck and figure it out. But also like, wouldn't it be nice if there was like an actual like, little, like a protocol to follow, say, yes, if we could create that for ourselves and for other physical therapists. So that's part of our research is we do articles and then we like kind of keep track of what's going on with our own patients. So I don't know. I feel like I've talked a lot. So if anyone...
No, you're
Well,
fine.
I was gonna say, and physicians need it too, because a lot of our patients are getting surgery out of state. And then they need general care, like an estradiol prescription or a topical treatment for like tissue healing along the way, but they're not gonna go back to San Francisco or California or Denver.
So they're here.
Yes,
So
right. So we need to have like general primary care people on board with these postoperative surgery protocols so that we can just call them up and say, hey, the patient needs this.
Right.
Or I'm sending you back, they're having this problem, but I don't need them to fly back to their surgeon to deal with it. And if we can get those little things dealt with a little bit faster, it would make all of the patient's post-operative experiences a little bit better.
Versus having to like keep fighting the steps through. And
yeah,
because of course we have 50 million protocols on ACLs and total knees and total hips, but and this area is growing. So it would be good to have that resource out here. I also am very I love that you guys are very cooperative. You know what I mean? Because I feel like in the world of therapy, if we actually shared more resources and we're like, hey, this person's maybe not a good fit for me, but like you would be perfect to work with them, or I need resources. I really love the cooperative part. So I just wanted to compliment.
Oh, thank you.
And Sam just texted me the other day. It was like, oh, so when somebody's like one of your patient's sisters or somebody is like coming to see me, and I was like, I couldn't tell you who that is. I couldn't even think because I mentioned you too often to people.
You're like, I don't know. It could be any of these.
I talk about you too much.
Yes.
But I think that collaboration was really important for me getting into private practice too, because I was not looking to jump into a world of feeling like we are such great healthcare professionals and patients deserve choices, right? So why are we doing this to ourselves to just do the fighting game when we all have niches within our specialties that we really like treating and we treat them really well.
Right. No, that's great. Do you feel like your patients do a lot of research? Because I did actually talk to another therapist who has, does work a lot with some of the gender affirming care, and was telling me that some of her patients come in and they've actually educated her on things because they've had to fight, kind of like how, it'd be nice if like the surgeons out here were educated on it, they've had to fight for it. And she was saying like things that she learned from the patient. So are your patients coming in with research that you're like, oh, who knew? Or like that sponsors things that you want to look into, or
have that always happens. The more patients are oppressed in our culture, right? The more that they have to become their own advocates, like through, unfortunately, these environments where they're not seen and validated in the medical system, right? So that happens so often with gender diverse people having to educate their medical practitioners. That's why we try to stay up to date, right? As much as possible. But people are always going to be educating us because well, I mean, one, they know their experience best, but two, I mean, I don't know how you get into this profession and then like people don't keep educating you. And then if you tend to lean towards the topics that are under researched, not including folks of all genders in the research, right?
Right.
Then we're going to run into a whole bunch of, well, we're not really sure. And someone's going to say like, okay, this is my experience.
Right.
And you start to catalog like, oh, this has happened 3 times now. Okay. Like that's some data for me, my brain.
Right. So maybe like, here's a note, like you bookmark it, right?
Of course. And then you hear someone say it a few more times and you're like, okay, well, we really need to pay attention to this.
Right.
And I find the same thing happens with like the POTS patients or the people who have a connective tissue disorder too, that they'll come in and they'll say, oh, I realized that if I take a hot shower, like I wasn't feeling well and I take a hot shower, then I feel worse because that like makes my POTS flare up.
Right.
And I'm like, oh yeah, remind.
Yeah.
Remember to like mention that
The
to someone who's like
patient.
struggling with their POTS. I'll be like, so you're really hot outside. Don't go in and take a hot shower.
Yeah.
Cool down first,
Uh-huh.
you know. So those little things are always happening. And then also just the resources out there in like our local community, they're always changing. So different providers move, or someone has a negative experience with a provider. Like maybe someone is great with like white, like trans mask people, but not great with people of color, or you know, or not great with fat people. It doesn't,
Yeah.
Right.
it could be something. So we try to keep like, I know I have a like a living resource document that is like, I write down, okay, this person is good for this type of patient as much as I possibly can.
Right.
And I say that and it sounds like I have this amazing resource list. It's not enough. It's
Yeah.
always not enough.
And I would agree, because I'm always gathering data from patients, and even some of mine that are going through like the diagnosis of exclusion with their autoimmune disorders or things like that, right? They're going from practitioner to practitioner, and they're updating me, and then they're like, oh, I have this person, and then they're like, never mind, that doctor was terrible, or never mind, don't go to this rheumatologist, or you know, or this, or like if they had a positive experience, I'm like, bring me a card, tell me what's going on. And it's never enough. It's a constantly shifting resource list, which I'm working on, but you know, because you want to get the best for each patient to get their individualized care.
Yes.
Absolutely. So what is a piece of advice you would give to a patient that is experiencing, whether it's pelvic floor pain or obviously going through a gender affirming like surgery, or just in general, like from your practice, like what is something you can give out to the audience as like your piece of epic advice, or just you wish people knew? I know you're like, oh,
I'm like,
crap.
oh, that's a broad question.
I know it's very broad. And also like, so the message of like, when I do this podcast is always fight for your healthcare, right? And a lot of what I've tried to get to people is don't give up. Like, I know that there's a lot of negative experiences in the healthcare system, and I'm always kind of like, grr, you know, but I feel like that's why I love talking to people and being like, hey, here's something cool. If you're in like North Phoenix, or if you're in Central Phoenix, or you're in Gilbert, like here's a really cool resource. So don't give up if you've had a crappy experience or someone hasn't listened to you. So my message is always like, fight for your healthcare, don't give up. You know.
Yeah, you know, there are good resources out there for queer people like in the Phoenix area and the surrounding cities. It is sometimes a little bit hard to find them if you don't know where to look. Like I know that some providers kind of like hide on their website, you know, like what kinds of populations they treat because they don't want to be a target.
Right.
We're out there though. And I would say that even if you're like, I don't have an issue that I would see you for, anyone could email either one of us, and we would absolutely do our best to point you in the right direction, or at least give you like some other places to look. I know that Trans Spectrum of Arizona has a resource guide that they are supposedly updating, like as we speak, hopefully.
So, yeah.
So that's a really good resource for queer people.
Affirming You is a mental health clinic in downtown Phoenix, and they have on their website, they have a whole resource page on their website as well for so I guess I would honestly tell people, as much as your like information is like, don't give up, I would also say like, pause, don't let your nervous system like dictate like you rushing into especially surgery. There's always a little bit of time for some rehab pre-surgery. So I love seeing people before they have a hysterectomy, before they have gender affirming surgeries for even 1 or 2 sessions, because before they have their prostate removed, right? Because that awareness of your body before it's had surgery, I think means that the connection afterwards ends up being so much better.
Right.
So I want people to like pause for just like a minute and consider like their whole nervous system and getting ready for their body to like go into surgery, and what do they need to set up so that they have like the best outcome.
I do like that for just in general, right? Because we live in a society that's an instant gratification society.
Mhm.
And so if I'm working with patients and they're like, I should just go get a shot, I should just do the surgery. And I'm like, or we work with what we have, because again, you run in, you get a shot, you get a surgery. You still have the same basic problems that got you here in the first place, right? Like for me, orthopedically, a lot of times I'm working on posture, I'm working on teaching people how to engage muscles they didn't, know that they had or whatever. Now you've had a surgery and now you really don't know how to use them. Now you're at a disadvantage, you're healing from something, and now you've got to access all of that. So I love the idea of like, let's pause. Let's uncover the things. Let's give you a good baseline. Then maybe we explore that.
Yes, I really love the way you put that also, Rebecca, especially. And so this is like from on a personal note. And then also I see it in quite a few of my patients. It's not going to be for everyone, but what I found for lots of people is that you go through this process, like as a trans person, that you learn like little by little, like who you actually are versus like who people expect you to be. And then once you come to terms with that, then when you think, I've actually waited so long. I've waited my whole life to become this person. I want to do it now because it feels so good to like find yourself. And so then even more distressing to not have like how people perceive you be like representative of who you really are. And I think that Rebecca's saying, taking that moment to pause and like really do your research also to figure out like, where do you want to go if you are going to have surgery, or what providers you're going to see if you want hormones, if you even want to medically transition, asking yourself all of these questions and not necessarily jumping into anything because there are really big decisions, and you want to make sure that the decision you make is the one you actually want to make, and it's not like a reactionary decision to make, I guess.
And is that also a moment where you would then connect from the mental health side of it, right? Like you've got this big decision, you've got all this stuff going on. Let us also provide some resources so that you can be addressing both ends of it.
For some people, yes. And for others, they're confident, right? And they're in there.
Yeah, I think it's like a version of always meeting people where they're at. So if it's something that I can tell that like someone needs additional resources, then you provide them. And if someone is, like Rebecca's saying, that they're absolutely ready, and then you're just there to support them in whatever capacity they need.
Right. Yeah, I think that's true, because even for me, like on a personal level, for having a surgery, so I had my tube side. I'm like, I'm not gonna have babies. It's the whole thing. Pre all of the dramas that we have in the world right now, but also just for my own medical, you get all the TMI you get, right? But I go into the doctor, and of course they're trying to persuade me of all the reasons why I still want to have babies and all the things that I want to do. And I was like, nope, let's do the things, So I had plenty of time. I'd already gone through all of the things and the medical stuff. And I was like, I'm ready, right? Like I'm ready to do the things. Let's go. So I had my moment to pause and consider and talk to the things. So I get it. You do want to find the people where you are, right? And so I think that goes for anything with medical or especially physical therapy. I feel like I'm going to pat physical therapy on the back and just say that I feel like we get to have a lot of that personal connection, which is why I think the cash pay clinics are not much better. There's great therapists everywhere, right? But it's just that you actually get that moment to be like, what does this patient need? What do I, to meet them where they are with that.
We're definitely have more flexibility than clinicians who have to take insurance.
Yes, so my first job, we had to see 25 patients a day. And I started having my own set of health issues because I was like, I couldn't even go to the bathroom, I couldn't eat. So I do understand when you're like, they start cutting the times. And I was like, I thought I had to like work like this because I didn't know, and it's just, you know?
Oh yeah, at my clinic, I literally like my bladder urgency got worse because I was
Right.
just so stressed, and I'm like,
Uh-huh.
I'm literally a pelvic PT, like
What?
helping
Yeah, as
people
you're
with bladder
destroying your own
urgency,
pelvic health.
like ignoring my
To treat
bladder.
patients.
Yeah.
So, and that's the terrible part, right? I think that medical practitioners will often sacrifice our own health for the patients like that. You're like, I've got to treat more of these people as you're like holding it.
Of course, like you got four people waiting for you, two people are on the
Right.
treatment table, one person's in the gym, someone's in the waiting room, and you're like,
Well,
I guess I don't have time right now.
I'll
Yeah.
pee at the
Yeah.
end of the day.
Yep, exactly.
I understand this.
But when your nervous system starts telling
Mhm.
you in so many various ways, like this isn't sustainable, this isn't sustainable, however it tells us,
Right.
like we have to listen to it eventually. I mean, if not, it forces us to listen.
Right. Eventually your body will rebel in its
Yeah.
own way. So with that, is that something that you also educate your patients on? Like your nervous system is telling you, like you need to.
I think that's like a daily conversation.
Okay.
Both with myself, although like
Uh-huh.
but I can feel also in like my private practice, like how much easier, like things that were distressful before, like treating people, are so much easier to navigate now just because my space is comfortable, my schedule is maintained by myself.
Right.
I don't do things that I can't handle.
Right.
I don't schedule myself like that. So my patients too, I want them to see that it won't happen. Like our culture will not allow that to happen. It'll do anything that it can to keep you going. Like it has to be an actual effort to stop and say like, is this functional for me?
Right.
And I think that nervous system stuff and teaching people like I call it like, so when your bladder spasms and you're like, oh my gosh, I have to go to the bathroom right now. Like I literally call that a bladder panic attack. Because for me, the bladder panic attack, I treat it the same way as I like treat a panic attack. Like I have to pause, I have to breathe, I have to think, I have to wait, I have to tell myself I'm safe.
Right.
And then my bladder calms down, you know? So, I mean, I think our nervous systems are always giving us these little cues, and sometimes they're really obvious, and other times like I think so when I call it a panic attack, so many people are like, oh, I was rushing, and I was I was in this meeting and it was just like going on forever and I hated it. And that's why my bladder spasmed. Right. And so I'm like, oh yeah, your nervous system's like talking to you. And that's a really good example of it.
I think that's like well, I mean, that's great for pelvic floor as well, especially because again, I think people somehow just associate it from like the regular things of like, oh, I pulled a bicep or I do whatever. But like when you were like this, it's going to be there, right? And that usually is going to go to the area that we're the most stressed out or that is having its own issues. So I really appreciate that, you know, because our society is like, you've got to cram so many things into your day. You've got to run and you've got to multitask while you're doing it. And, you know,
you're not valuable unless you're productive.
Yeah. And you're constantly at like,
I think another good example is with the IBS like symptoms, right? Some people were dealing with like gastroparesis, and I'm always like wanting to find out, okay, like what does your day look like around eating? And so many people are like, eat, go back to work, right? And eat, go do something.
They don't actually get to enjoy
eating in the car on their way to their job. And how does our body like handle that without like the ability to like rest and digest for even 10 minutes if we can get that out of someone's day. Like, so that's a lot of my fundamentals is like no one's going to give you the opportunity to have 10 minutes in your work day. You have to like close the door, hide somewhere, like put your headphones on, tell people that you're not available to get your 10 minutes of space. Right. And that's hard.
And I think that also people don't always think about like the gastro side of things, right? They're just like, oh, it's urinary, it's the bladder, but like all of that is dialed in with that area. So,
I mean, everything is so closely related in that area of the body that you can't say that nothing happens in a vacuum. That if you have issues with your pelvic floor, there's probably something going on with your bladder. There's probably something going on with your bowels. That there are things that can be worked on. And if you just do one thing and you ignore everything else, then
if you're just
then you're not treating the whole
you're not
person.
looking at
Yeah,
like, the
oh
rest of
God,
you.
oh God. The Kegel debate, the Kegel debate. This podcast could be literally 5 hours long if we start the Kegel debate.
Right, we'll just poke it and run away. But yeah, that's like, I feel like I'm not downplaying Kegels, but I do feel like so many people just probably come in and think that's all they're going
Oh,
to
yeah.
do.
Right.
Yes.
You know,
Yeah, that's
even-
not it. No.
Mhm.
Even in passing, I just had a patient husband. He's like, "Could you just show me how to do Kegels real fast? Because I think I've got a thing." And I was like, "First of all, I'm gonna refer you
Yeah.
to someone else who does this, and
Mhm.
that's probably maybe not even what you mean. So
Yeah.
let's just I was like, I would feel like a irresponsible therapist if I was just like, here, do this video,
Mhm.
and who knows what's gonna happen when they go home.
Especially when, like, you were thinking about cisgender men, they
Mhm.
keep getting the message to do, like, from urologists and, like,
Mhm.
whatever website they're looking on, it's like 300 Kegels a day. And I'm just
Uh-huh.
like, what is going on?
Yeah, no, and that's
Why is this
only,
information that we're still giving people
there's a really small subset of patients, I think, that
Mhm.
actually
Yes,
need that.
that actually
There
need
are
that
some
type
people who
of-
do,
Yeah.
but majority of patients, like, please, like, tailored care for you, for what's
Right.
going on with you right at this moment. That's what people need. Kegels are like not a one size fits all.
Mhm.
Yeah.
I feel like social media and probably like a lot of physicians are just like, do these things. And so I think I like that. I like go and be in the thing and have your actual issue assessed. And then that's when you can dive into probably there's a bunch of like you start unburying, maybe there's a connective tissue thing. Maybe there's this going on. Like, let's figure out the root of this and give you a whole
Yeah, and social media is awesome because it's like creates accessibility for a lot of people
Mhm.
to be on the platform and then also to receive information. Like both ends of it is really amazing. But when you have to limit the amount of information to this like very simplified version, people are not getting the whole picture. And then also a lot of times it's in order to sell something. So whether it's a program or a product or whatever, I think it's important to just know that when you see stuff on social media, that you're not getting all the information and that anything that's being sold to you is not going to be a one size fits all, that there's probably a lot more things that go into like whatever is your issue that you need to resolve.
Yeah, my red flags for all those products, like pelvic health products, when people are asking me and reaching out, and I'll just tell people like, is the website really trying to catch all symptoms? Or guarantees. Guarantees in healthcare are a red flag for me in patient care. Like if you're saying this supplement, we guarantee you're not going to have urinary incontinence, right? Like we guarantee it'll eliminate your neck or back pain, right? Yeah. Like you can't do that. So let's.
Well, and it's interesting. I've seen a lot of them targeting ADHD right now. They're like, oh, do this and you could do this. Like, and this is, and I'm, this is a thing that specific ADHD people have. And I'm like, this is just poor posture. Like a lot of people have this. So you don't have to, and I've been seeing that more recently in these social media posts. And, but if you give me $5 a month, I will fix all of your things. And so that is, I like that you hit the red flags, right? Like if they guarantee they're going to fix you, be aware. And then my advice is always take your post that you saw and contact your therapist.
Right.
And go over it when you're in your next session and be like, here's what I've seen before I try anything or whatever. How does this tailor to me? Because the hardest part for me as a therapist is I've got patients and I'm like, I saw this thing and I'm trying these exercises. I'm like,
Yeah. Wait, take a pause.
Yeah, back to the pausing. Yeah. Let's just, when you see it, if it's interesting, send it to me first.
Yeah.
And then we'll discuss at your next session.
And there's actually a lot of physical therapists online right now that say, these are my top 5 exercises for pelvic health. Like I see those a lot. And I'm like, okay, well, some of these, like I think will help a lot of people, but they're not the same thing. Nothing's one size fits all. And they also won't tell you, what is this exercise doing for you? Like, why is it important? What, like, did you need in your body that means that you have to do that exercise? And so to just say, oh yeah, you know what? Just go follow that Instagram account. You don't need me.
Right. Yeah.
That's not, it's not enough.
Right. And I do put random videos out for people, but I always try to you have to put the disclaimer, right? Like, here's this and try this, but obviously this is, you have to have a disclaimer. And like, sometimes I put my public service announcements, but I'm not like, this will solve everything, but so just being careful. I have to cover my own butt on it. Right.
Yeah.
So, well, I think I have probably bugged you with a lot of cool questions, but I'm also going to keep bugging you because I want resources. I will probably link to the pod, and I'm really excited to read that article actually. Just again, because I do see a lot of, like in the aerial community and in the circus community, there's a lot of people dealing with connective tissue disorders.
Yeah, well, I would love to continue talking with you also because anything that we can do to share, resources or like pick each other's brains about something that we're like, oh, I have this patient, who's struggling with this. Do you have any ideas? Like,
Right.
I love having those types of relationships with other PTs.
Perfect.
Yeah,
And what's the connectivity? So, any last comments or piece of advice or?
I don't know, reach out to us. We both have websites.
Yeah.
And you
We
can ask
will-
us questions.
We will link all of
Yeah.
the things. And again, if you're looking, and I always just encourage people, even if they just have questions, like set up an appointment and even if it's
We
just
do
one.
phone consults,
Yeah.
right?
Oh, you do phone calls?
Yeah,
Oh,
we
that's
both do
perfect.
phone consults.
Yeah, so even if it's just to ask your questions, because sometimes for me, I'll have patients and they're like, I have a question, and I'm like, just call or just set up a consultation just to get your questions out there. And whether sometimes it just makes you feel better there, or then you realize this is a resource you need.
Mhm.
Exactly.
I'll say too that because sometimes phone calls are scary. As I'm saying, I treat lots of neurodivergent people,
Yeah.
also neurodivergent myself. So phone calls are scary. Like you can text my business
Yes.
line. That I mean,
Same.
Okay.
You
Don't
can
give
text me,
your-
it literally says
Uh-huh.
it.
yeah, don't give your personal health information over text unless you're like, I don't care if people know.
Right.
But if you want to protect your health information, then don't text personal questions.
Right.
But if you have a question about therapy, you can text it or you can email it.
Okay.
And I think we're both very responsive. So
Okay.
Yeah, I love text messages, right? Because you
Yeah.
can text people in between appointments.
I do the same thing.
Instead of
So
playing phone tag.
I would rather have my patients text me and like we get back really quickly and then we can
Yeah.
learn from there. So I understand that. So
Love
we'll
that.
link both of your businesses so that way people can have that option to be able to text or even just ask questions.
great.
Yeah,
Thank you so much.
Thank you guys. I really appreciate it. And I appreciate all the cooperation too. So
nice chatting.
nice to
I
chat.
know we have our little community now.
Right?
Yay.
Thank you for tuning in for today's episode. As always, we hope that you found some nugget of information with all of the stories that these guests have to share. And always feel free to follow Better Fit Therapy online on all of the social medias, Facebooks and Instagrams and all the fun things. Feel free to message at any point as well if you have a condition or you have a topic that you would like to explore. Feel free to send that in. Also, if you would like access to any of the resources or things from a different episode, please always feel free to send in a message and we can direct you. And again, thank you for taking the time and don't forget to fight for your healthcare.